So we'll scan for the popliteal sciatic nerve and its branches, the tibial nerve and the common peroneal nerve. So to do that, we'll place a linear high-frequency transducer at about the popliteal crease. Again, we usually look for vascular structures first as our landmarks. So you'll see the popliteal artery basically in the center of the screen there. And then it's indicated here by the arrow. So once we found our artery, we're going to look superficial, okay, and lateral for our branches. So here you can see the tibial nerve. And a good tip for visualizing the structures of the sciatic nerve and the common peroneal nerve as well as the tibial nerve is to vary your tilt a bit, because we know that the nerve actually comes from deep to superficial. So the tilt that we usually want to do is with the tail towards the head, and that will bring out the nerve a little bit better, just because that nerve is coming from deep to superficial. So as I scan up, I'm just going to vary that tilt just a bit to try to bring out the nerves just a bit better. So we're seeing the two nerves now, and they're joining together to form the sciatic nerve. So you can see here by the arrow we're indicating the sciatic nerve, okay? And if I scan distally, they will bifurcate, okay, into the common peroneal nerve and the tibial nerve. And you can see that I'm just varying my tilt just a little bit to bring out those nerves. So my arrow is over to the common peroneal nerve because the dot indicator is lateral, and then this is the tibial nerve. So if we continue to scan downwards, we'll see the common peroneal nerve further deviate laterally, okay, and then wind around eventually the fibular head. We'll focus our attention though on the tibial nerve, and so I'm just going to reduce the depth, and then we'll scan down just a bit further. So the tibial nerve is still here, and right now we're seeing the emergence of the gastrocnemius muscles, so the medial and lateral heads of the gastrocnemius. What happens in this area is the tibial nerve will give off branches to innervate the medial, okay, and lateral heads of the gastrocs. And they travel through this hyperechoic plane here along with vessels. But this is where the nerves basically run, is in these fascial planes here. As we go further deep, we can still see the tibial nerve here. And again, we can play with our tilt, okay, and try to follow it a little bit more distal. Sometimes it's difficult to track in this region, okay, but I think we're still seeing it here, okay. And eventually the tibial nerve will also give off branches that go to innervate the soleus, which you might see here. So this might be a intermuscular branch innervating soleus, which is deep.